Drowning is referred to as deaths after 24 hours of submersion. And near drowning, when we are defining near drowning, it's basically survival for 24 hours after the incident of submersion has occurred. So basically, this is what we are dealing with in this first section, and the science and estimation of duration for this submersion phenomena. It is very important as a forensic practitioner to calculate the time since death and the time since the incident took place. So these are the basically highlights for this section and how we'll be discussing them in detail. Now, the time since death for its calculation, whenever we are discussing drowning phenomena, it is quite different for the freshwater drowning and it is quite different for the saltwater drowning. And saltwater has its own characteristics and basically it delays the death phenomena. So this is basically how it is going to affect. And a lot of other factors are also going to affect the time since death. It's basically the temperatures and the climate requirements for the particular area in which the drowning took place. And then there are the predators that are involved in that water. For example, the crustaceans, the mollusks, the crabs, and a lot of other predators that can be present in the water and the type of water in which the drowning took place. So all of these factors come into play whenever this drowning incident takes place, and it is very important to discuss all these factors in detail. Now we'll be discussing the definition for the immersion deaths in detail. And moving on, we'll be discussing the science for immersion. So whenever we have a look at the body, we sometimes instantly have a picture in our mind that the death took place due to drowning. The underlying cause for this death is drowning. And how does it happen? What are the typical signs? For example, there are a lot of terminologies that are used for the drowning deaths. Maceration is a phenomena which is seen in drowning. And then we have a lot of even the skeletalization process is quite modified for the drowned bodies. So then there are phenomena like cutis anserina, and all of these phenomena are basically typical for the drowning deaths, and basically they are regarded as the signs for the immersion deaths. Moving on, we'll be discussing the estimation of duration of immersion. So the incident, how it took place, we can calculate that slightly, and we can calculate the time since death for this incident and the time since death for the death separately. All of these calculations are very important whenever we are investigating, whenever we are carrying out any crime investigations, and we want to know when the incident took place. So these are very critical and they're very important in these sense. Now, the immersion deaths. Immersion deaths can be deaths from natural diseases before falling into the water. So all of these basically are a part of the immersion deaths. It can be some natural cause, even the underlying cause can be some pathology that was already present in that person. So even the underlying cause can be highlighted as that pathology. For example, it can be any aneurysms that ruptured, and that is the underlying cause. So we'll highlight that the drowning took place, but the underlying cause is basically the aneurysm that ruptured. So any natural diseases were already in water. So any pre-existing diseases, they have to be highlighted. Any natural diseases that took place inside the water, the pathologies are also discussed over here. Then injuries before being thrown into the water. So the differentiating between ante-mortem and post-mortem drowning is the mainstay for a forensic expert, for a forensic practitioner. And while you are carrying out the investigation, or you're writing down your own report for autopsy report for any drowned person, you should be knowing that how you are going to differentiate between ante-mortem and post-mortem drowning. So or if there are any injuries that were recorded before the drowning took place, you will highlight them that these were the injuries which were present before the incident took place. Injuries while in water, they're another thing that you have to focus on. They're basically, they can be any kind of trauma, trauma through the predators that are present in the water, trauma through the blunt stone trauma, even that can be rock trauma that can be present in the freshwater drowning. Now, the effects of immersion other than drowning. There are a lot of other effects other than drowning and that are discussed in, basically that should be discussed while you're writing down the autopsy report for any death that was suspicioned as a drowning death. Now, drowning, in particular, if the death occurred due to drowning, you will just highlight in your autopsy report that the death basically occurred due to drowning. There were no pre-existing diseases. There was no other kind of trauma that took place before the incident of drowning took place. So the signs of immersion, how are you going to identify that the death was due to, that the immersion took place? Right now, we're not basically differentiating between antemortem and postmortem drowning. We're just focusing on that anybody, if you'll have a look at it, and you're just quickly going to diagnose that it is basically death. This body was basically immersed in water for whatever period of time. How are you going to do that? It's the maceration of skin. So maceration is basically thickening. Basically the skin becomes quite thick and leathery and whitish in appearance, and this is called the maceration of skin, and it's basically nature's way to preserve the body. And even in very extreme cases of maceration, what happens is the maceration is basically, the sites which are involved are the palms and the soles specifically. They're involved for the maceration phenomena. So what happens is, if there is prolonged immersion, a glove and stocking pattern kind of a process comes into play, and the skin can be removed for the fingerprinting and the identification of the person. So it's basically a nature's way of preserving someone's identity, and it's very important in these cases. Then we have cutis anserina or goose flesh, as you can see in this picture, in this diagram. It's normally known as the goosebumps phenomena, and it is usually seen in temperate waters, in a rather cold water. That is the kind of temperature that is required for this cutis anserina or goose flesh or goosebumps phenomena, which is seen in deaths due to immersions. Now, as you'll be seeing, the hypostasis is also of no value over here. Why? Because in freshwater drowning, what happens is the body is continuously moving. And even in the salt water, the body moves slightly. Usually the position of the body is such that the knees and the hands are in the downward position, and the back and the buttocks are in the upward position. So this is how basically, when the putrefactive gases accumulate in the body, this is the position of the body in that sense. Then we can collect mud, coal, slurry, oil, silt or sand, and these may be present inside the skin. Now, the estimation of duration of immersion, it is very important. If there is no wrinkling of the finger pads, then almost a few hours have passed, or even less than that have passed for this kind of presentation. Then if we have wrinkled fingers, palms and feet, and they're progressively getting wrinkled, it means that a day or 3 has passed on after death. Then if we have an early decomposition phase, often first in the dependent parts, that is the head and the neck, and then in the abdomen and in the thighs, then almost 4 to 10 days have passed on for the time since death. Then if there is a bloatment of the face and the abdomen with marbling of the veins and peeling of the epidermis on the hands and feet and slippage of the scalp, it's basically the maceration process. And it basically signifies that 2 to 4 weeks have passed since death. Now, if we have the gross skin shedding phenomena, the muscle loss with the skeletal exposure has started on, and there is partial liquefactive processes. These are basically all the decomposition processes that basically set in after death. This means that 1 to 2 months have passed on since death. So this is basically a quite logical explanation for the time since death phenomena. So in this section, basically, we dealt with if we have a body at our hand in which we have suspicions of immersion, how are we going to calculate the time since death? That was the end of this section. Thank you for watching sqadia.com.